My platform for the 2022 elections is the advocacy of health. That is an unfinished business as far as I'm concerned. In my 2-term stint in the council, so if given the chance to be back in May 9, 2022, I will continuously advocate health. Two departments that I want to focus. First is City Health, which is the preventive aspect, and second is Cebu City Medical Center, which is the curative aspect. So, pabutang ka diha, given the chance, we will strengthen the services of City Health. How? By strengthening the services of the health center in the City of Cebu. So, na ito pagpaligod sa serbisyo sa atong mga health center is atong paligunon by putting putang na ito mga ekipo ang atong health center. To begin with, atong health center should already have ultrasound, x-ray, and diagnostic. Meaning, ana ta pagwagdugo sa sentro. If you can remember in the pandemic, lisod-usod sa hospital, di ba? So, basically that, and atong paninuhaon, atong tanang barangay health workers, anhin na magserbisyo sa atong katawhan city level to monitor sa atong mga tanang-taw nga nasakit, especially katong bedridden. And on the curative aspect, which is Cebu City Medical Center, we fully know that it is not fully equipped and not fully operational. So if given the chance, atong paningkamoton, ang atong Cebu City Medical Center, sakto sa ekipo. Kinanglan na CT scan, MRI, ultrasound, X-ray, diagnostic. Ang pinaka-importante, kompleto sa tanang espesyalista sa doktor. Nga naman, simpakulang o masakita, no, hindi na kaya sa sentro. Labi na atong nakaisunan nga atang sa ubos. Suod sila CCMC, maingan sila sa doktor nga kinanglan ka o CT scan. Dili mapatigayan ang serbisyo kay tungod walay ekipo. So inon sila sa doktor, tagaan ti kay note at ipatigayon sa pribado ng ospital. Dili mapatigayon sa pribado ng ospital kay walay kwarta. So hopefully that will be the project I want to finish if given the chance to be back in the City Council. Thank you.
You ran for what councilor in the
North
North District.
Sir Jun, okay question?
Ay, good sir. Direk, ipatuman sa una si former Mayor Bando Osmeña. Ito mga medicines na ihatod dito sa
Long life.
barangay o long life. Plano nyo na
Ipadayon. Definitely, if it will be an Osmeña administration under the leadership of Bando Osmeña, that is a priority. Padayon din na namabot ang servisyo dito sa ubus sa katawhan daw sa city natin. Ilang na niulong yung karoon. That is supposed to be preventive.
May question? Ma'am, any
Well, ako lang awag sa mga butante, lagi na sa Norte Distrito nga matigaan ko kay Gayunan, makabalik sa konseho karon umaabot nga pinili ay this is an opportunity for us to make a difference, especially sa atong panglawas, sa atong advokasya sa panglawas. So, if you want a strong barangay, a strong city, then you have to have a strong people. So you should start from the basic, which is health. If you have wellness, good health, and well-educated people, so nindot ang atong syudad, nindot ang atong barangay. So, and in addition, I am very proud to tell everyone na it is only Barangay Lahug who has the Barangay Behavioral Health Unit. So I am advocating mental health also. This time, I am changing the definition of health. It should be integrated health already. It's not only medical, but it's medical and mental health. Tungod sa nahitabo sa pandemya, it is already very important. If you can see sa una, when we talk of health, ang nasa tungod na una is only medical. When we talk of medical, ang nasa tungod na una, sakit rin. Hypertensive, cancer, heart disease, diabetes, ugaban pa. Pero pag sa pandemic, nausap na nan. Daghan ang namatay, daghan ang nawag na nagtrabaho, daghan ang depression. Gani hantod karon mo pagkabawi, no? So that should be given focus, that should be given a priority, and that should be equally be the same with the medical aspect. So now the definition of health should be integrated health, medical and mental health. If you have the time, anyone, visit Barangay Lahug because we are the only one in the country who has the Barangay Behavioral Health Unit. It's in Lahug and it's functioning.
Ano sa'yo isugdan mo? Ano sa'yo mo na pupunta? Ano sa'yo mo na...
Yes.
Ano saan na nagsugod ng
I'm sorry. Nagsugod in 2017.
19 na launch.
2017. So, karon, if you are depressed, you just go there. We have a psychiatrist, a psychologist, and a social worker.
Okay. So far, ma'am, pila naman na-service ano, ma'am?
Daghan na serve ng Lahug. I cannot give you the exact numbers, but if you go and visit Lahug, kita rin na.
It's only for Lahug, ma'am, or it's open for everybody?
It's open.
Walk-ins are allowed?
And if you are, sometimes when getting mental health is a stigma. Up to now, it's taboo, no? So, ganahan mo to privately pay a visit there, you can. We have an on-call psychiatrist, a psychologist, and a social worker.
Budget sa barangay naman?
Barangay, yes. I initiated the ordinance already. In fact, ang atong ordinansa nag-mandate na tanan barangay should have a barangay health worker. Pero the implementation of it is in the executive. So sadly, pagka pili na po sa 2019, it was not implemented. The only barangay implementing it is me. That is very nice, no? Kay, in fact, if I'm not mistaken, that was authored by Senator Risa Ontiveros, mental health, and I think with Senator Soto. He mentioned that in his campaign, giving priority to mental health. That is the in thing now. And mental health is all about life. It's all about our everyday living.